Hello, my name is Jessica Ramos, and I'm a student at Western Governors University. I am currently in the Nursing Leadership and Management program, and for today I will be doing a presentation of my capstone. And for my capstone, I have designed a handoff protocol to prevent self-extubations in the critical care unit at Kaiser Permanente in Irvine, and I called this handoff protocol TUBED. Okay, so I will start off with the introduction. So the reason why I picked this topic was because self-extubations or unplanned endotracheal self-extubations, UESE, of patients in the critical care unit have been an ongoing issue since 2015. There have already been 3 reported cases for 2016. So the goal was to, of course, decrease the incidences of self-extubation, and that's why I created TUBED. TUBED is a step-by-step checklist that will help staff management and the key stakeholders involved to identify the causes of self-extubations as a way to prevent them in the future. So let me start with introducing TUBED and all its components. So T stands for time, U stands for up, B stands for bedside report, E is for extubation, and D is for document. So T is for time. So this is the area where nursing staff, healthcare providers, and other healthcare personnel would, figure out when the patient was intubated and why they were intubated during this time. So this is kind of where we look at the patient's situation that at that time that they were intubated, like vital signs, lab results, any other issues that were going on that time. And U stands for up. So this is where the healthcare provider and the nurse assess the patient's alertness and or restlessness. So this is where we assess whether the patient is anxious, whether they are adequately sedated, whether they are in pain. And this all has to do with, this will all address patient comfort. And then B stands for bedside report. So this is the area where we check whether the oncoming nurse and the nurse leaving his or her shift verify any equipment and any medication or drips that the patient's on. And this is also a good time to assess the patient's condition and make comparisons. Like, is the patient progressing? Did the patient look does the patient look like he's in distress now compared to before? And then E stands for extubation. So this is where all the various healthcare providers and staff discuss the patient's readiness for extubation. So again, this is where we, look at the patient's daily progress as far as the vital signs, again, lab results, inability to wean off the vent, and all the other stuff that would help us determine whether the patient's ready for extubation. And then lastly, D is document. This part of the checklist will allow the stakeholders to keep a record of the absence and presence of UESE in the unit. And this will also include other interventions that were being performed. And this would include restraints, which medications were being administered, titration of these medications, and all other factors that would need to be documented. So next one would be evidence and current practice. So the evidence gathered has definitely helped create the components of the TUBED checklist. The first one would be adequate and knowledgeable staff. So this has a lot to do with safe nurse to patient ratio. And then research also states that staff who are more knowledgeable and are more confident in carrying out protocols will do their tasks more effectively. And supportive management. So this is very important. Also, as far as safety goes, management is responsible for making sure that their staff is knowledgeable, that they have adequate nurse-to-patient ratio in the unit. So this would help prevent self-extubations. And the next one is appropriate sedation and pain management protocols. So this was part of the U in the TUBE checklist, and as well as bedside report, because this is where we assess whether the medications that we are administering to the patients are effective in helping them be comfortable while they're being intubated. Next one is proper documentation. So proper documentation has not only led to lessen incidences of self-extubations, but it has also improved the communication between staff and healthcare providers. Better communication and collaboration between all healthcare personnel ultimately lead to decreased medical errors and increased patient safety. So next one, I will be talking about the capstone project steps. So this involved a total of 12 weeks. So the first week involved the collection of evidence-based research and peer-reviewed journals that discuss the causes and recommended practices for the prevention of UESE. 30 articles were reviewed, and I've only chosen 21 for a more in-depth review. The nursing managers, charge nurses, and staff nurses were interviewed regarding the various incidences. Their input included the number of self-extubations that have, and the exploration of causes and suggestions on how these episodes can be decreased. And during week one, analysis involving the comparison between research gathered through the Western Governors University Library and the interviews in the unit were made. And then after all the research was gathered, I set up a meeting with the preceptor for my project, who was the house supervisor, and together we discussed the issues and expected goals and outcomes for the project. We also talked about the time frame and resources needed for the project, and this is when I obtained my approval for implementing TUBE. Okay, so week two. So after all the research that I've gathered, I've developed the TUBE protocol. And the checklist, I initially presented the checklist to the supervisor. And after that, an approval for the recruitment of the stakeholders was obtained, and I had to get that from my preceptor. And these stakeholders were then contacted via email in order for me to present my project. I included a brief introduction of myself and a summary of my project in the email. And we also discussed a potential location and date for when I could present the project to the stakeholders. In week three. So week three involved a thorough presentation and discussion of the project to the stakeholders in the ICU conference room. The resources that I utilized at this time were printouts of the checklist, and I handed this out to the stakeholders who were involved. And during this week, I welcomed recommendations and feedback before I would present my project to the staff. And then by week four, I have finalized my project, and me and the stakeholders worked together to present this to all the staff. It was presented to ICU staff during every huddle before both the day and night shifts began. And we used the ICU lounge and ICU conference room as the set locations for any kind of meeting, like the huddles or any educational purposes, which I'll be discussing later on. And then a brief discussion of the project with an attachment of the checklist was also forwarded to all staff via email, just in case there were some staff that were not present during the huddles. Okay. And then the fifth week, this was when the official pilot presentation of the project was conducted. The checklists were made available in the lounge and in the nursing stations, and this is where all the forms of documentation were present, such as consents, surgical procedure information, and any other kind of educational material and brochures and such. And support was, of course, always evident from the student, myself, and the stakeholders during all times. And then week 6 through 12 was when the project's implementation was being continued. Constant support, communication, engagement with staff and stakeholders were being rendered throughout the entire time. Follow-up meetings and email updates were done. Me and the stakeholders decided to do follow-up meetings every 3 to 4 weeks and do the email updates on a weekly basis. So now I'll be going with reflections, and I'll be talking about the successes of the projects and the challenges that we faced. So successes. So the main goal of decreasing self-extubations was achieved since the project's launch. There have been no reported incidences since then, only the 3 that happened before the project was launched. And on top of achieving this goal, communication between healthcare workers was significantly strengthened. This project allowed the participants to be in constant engagement and communication with each other through meetings, many educational lectures, and emails. They were also able to showcase their expertise and provide input in how to make the project better through constant feedback and recommendations. Staff was very receptive to the protocol, and the stakeholders were always there to guide them in every step of the way and just to provide ongoing guidance and support. The other successful aspects would include choosing a topic that affects the entire unit and patients, as well as the staff and stakeholders, because everyone then was more motivated to do their parts as if a topic that affected everyone and would be taken on. Okay. How can the successes help inform future projects? So my project was nurse-led, so it just goes to show how having nurse-led projects can be very significant in addressing ongoing issues. I think it makes it more relatable to staff when their fellow coworker implements this. And like I said, I have addressed important and current ongoing issues. So, an issue that affects everyone, motivates everyone to participate and combat all these issues. And then also, the protocol also shows the importance of using professional research to make changes to a problem or a practice. So, before presenting to staff, I made sure that I had evidence-based research to back up my my protocol. Okay, now, and then also quality. It just goes to show how quality improvement projects require constant monitoring and staff flexibility to assure satisfactory outcomes. So, we really made sure through weeks 6 through 12 that we continue to provide ongoing support. We were very, with our work schedules, it was hard to get together at times, but we made sure that we were flexible in order to really promote the project and made sure that we reached the outcome goal. So aspects that did not go well. Okay, so as previously mentioned, the protocol was a success, but the aspects supposed to be a challenge were our work schedules. Even though we tried our best to be flexible, it was still hard to get together. The nurses involved from both management and staff, we all had different shifts. Some work days, some work nights, and occasionally some would even come in for mid-afternoon shifts. Also, some nurses would only work 3 days a week, some would work 5. So it was just really hard to find a perfect meeting time. And also, yes, unpredictability of hospital workflow. So this does not only apply to the nurses who have already crazy schedules, but also applied to the intensivists who were also key stakeholders. So it would be hard to get them to come into the meetings because they'd be bombarded with texts and pagers to attend to emergency situations or just to attend to their patients. So it was really hard to, work decide a good time for everyone to meet up and discuss the project's progress. How can these challenges help inform future projects? So, as with any project, gathering all the participants is usually a common challenge due to everyone's varying schedules. And the hospital environment is one where time is limited, it's extremely variable and unpredictable, making this a big challenge for any project or policy being implemented. But fortunately, due to the use of technological advances, communication and documentation purposes are made easier. So as for this project, we use technology in the form of emails, overhead paging, especially for intensivists. Like when we need them for the protocol, we could just overhead page them. We tried our very best to meet up. And then we also had electronic flow sheets. We used the Epic system. So the system allowed each healthcare personnel to make their own notes and even to write messages in order to communicate with other healthcare personnel. And then we also used an airmail paging system. So this was actually the system that we used in order to contact the doctor. So it made technology made everything easier for this project, and I'm very confident it'll help to make future projects more accessible. So now we'll be talking about the short-term and long-term goals for the protocol. So short-term maintenance plans. So this will include continuation of the use of this protocol for the management of patients who are mechanically ventilated. If the protocol continues to be a success in decreasing self-extubations after 3 months, I'm really hoping that its utilization will be continued. Another short-term plan would be to continue meetings with stakeholders to discuss the project's progress. And as time goes by, meetings would not need to be as frequent, but I made it a point to, just with everyone's schedules and everything. So I just made it a point to make sure that we still stay consistent with email updates, on a weekly basis. And this topic will always be included in our huddles and our meetings. Long-term plan. So for long-term plans, we'll include a consistent year of using the protocol. And then my hope is that the protocol would be published as a hospital policy. So this is when I would set up a meeting with upper management, like the chief chief nursing officer, and as well as the educators of the hospital to make any further modifications if necessary before it becomes a policy. And then another long-term goal would include the continuation of proper nurse to patient ratios. And then appoint TUBE champions in the unit. So these TUBE champions will be available during every shift to serve as a super user for staff. They'll basically be equipped with the knowledge to assist their coworkers in how to proceed with the protocol and to make sure that the right documentation is being done at all times. The use of this protocol will always be utilized during multidisciplinary roundings and bedside reports. So, like I said, I would always make these checklists available in the lounge, and they'll be utilized during every shift. Next slide would be resources needed for post-implementation support. So this would come in the form of continued education. So TUBE would always be listed, as one of the topics being discussed during monthly meetings and huddles during every shift. The protocol would be made available in the staff communication folder, and this is where staff are able to retrieve any handouts needed for educational purposes. It will also be included in the online learning modules as well as annual skills day for employees specifically working in the critical care unit. And then stakeholders would continue to render meetings and email updates to discuss the project's progress and, like I said, to do any modifications if necessary. And staff incentives. So I discussed this in my paper, and staff incentives would include simple things like potlucks being held for staff, whether a monthly potluck if we had absence of self-extubations. And then location availability. So we would always utilize the ICU lounge and the ICU conference room for the project's implementation. So next one is the 2 MSN program outcomes. So the first outcome is design innovative nursing practices to impact quality outcomes for individuals. So the TUBE checklist is a nurse-led project designed as a tool for nurses to be pioneers in decreasing the incidences of self-extubations. All the components of the protocol serve as a guide to help nurses make the proper assessments for patients who are mechanically ventilated. The goal of the self-extubation prevention is achieved by reviewing a sequence of steps that assist the nurses and, more importantly, encourage their critical thinking skills. Prevention of complications and being able to react efficiently to emergency situations is already a big responsibility for nurses. So by utilizing this tool, not only are self-extubations prevented, but other issues that significantly affect the quality of care being delivered to patients are addressed as well. Examples pertaining to this project and this MSN program outcome would include the administration and titration of sedatives and pain medications. So this tool guides the nurse to assess whether their patients are responding well to those medications. They are given the opportunity to discuss their findings with the physician and to come up with the correct medication of choice, dosage, and frequency that is individualized for each patient. And then the evidence summary in chapter 2 of the paper emphasizes that patient comfort and absence of distress have been shown to lead to decreased self-extubations and less problems during their hospitalization stay. And then the second MSN program outcome I talked about is construct interprofessional teams to communicate, coordinate, collaborate, and consult with other healthcare professionals to advance a culture of excellence. So this project would not have been possible without the key stakeholders and most especially, the staff's full cooperation. Recruiting stakeholders with different roles and expertise enabled various cares of the intubated patients to be addressed accordingly. It also helped nurture an environment where all these different disciplines were no better than the other, but instead showed how combining everyone's talents and skills would only benefit and impact the quality of care being given to the patient. Nurses were also being given the opportunity to be heard and listened to by physicians when it came about to recommending patient treatment and interventions. Physicians were able to collect input from other healthcare workers in order to make the right diagnosis and decisions as well. Bedside reports enabled staff to make the proper assessments, which led to decreased medical errors and better teamwork. Day and night shift nurses reported better collaboration and improved communication amongst each other. The project encouraged healthcare providers and workers to realize that patient care is truly a 24/7 job that can be negatively and positively impacted by how their professional relationship is with each other. And I think in order for patient outcomes to be successful, an appropriate delegation of tasks, sharing of ideas and innovations, and accountability of actions amongst all healthcare personnel is extremely crucial. So basically, it was the effort from the staff, the healthcare providers, and the key stakeholders involved. This project wouldn't have been possible without everyone's work. So my last slide, I just wanted to thank you for allowing me to present the Handoff protocol that I create, which is TUBE. So thank you.